Just to acknowledge this important motion brought forward by my colleague Mark Ward. We all know how COVID has taken its toll on mental health. Speaking to parents and young people, every one of them tell you they are in varying degrees of stress and anxiousness. Children have been missing their sports for over a year. That void has had a huge impact on their mental health and increased stress on their siblings and their parents. So people who otherwise would have had good mental health are now struggling, and those struggling previously are in distress. I heard William Cummings, who does fantastic work with Babs Listening Service, say recently that it is only when we listen we truly understand. When we understand, we can begin to help. In order to reduce the numbers of those with poor mental health from becoming increasingly distressed, we need a significant investment in non-medical support for talk therapy. Sinn Féin would invest in a talk therapy fund of 10 million. This would create 128,000 sessions with accredited counsellors or therapists in the private system for urgent care on referral from a GP. We would ensure that before individuals are in distress, they are able to talk to a professional who engages with them. This fund and service would be really important and help to prevent individuals from entering emergency services. This emergency talk therapy fund has to be a priority. In line with this, there needs to be universal counselling within the counselling and primary care services, so counselling services are not barred from individuals because they just missed out on a medical card. Sending an individual who is suicidal to A&E has clearly not worked. Because we have not got the required services. We need to open up private hospital care so the pressure is relieved within the public health system. I read recently that the A&E hospitals are like ground zero for mental health patients. We have one of the lowest proportions of hospital beds for psychiatric care in the developed world, and bed numbers drop each year. With every bed that is lost, the threshold to admit someone to hospital must rise. Patients need to be sicker and sicker before they can be admitted to hospital. This is 2021. We have had Fine Gael and Fine Gael working together for almost 6 years, and Fine Gael before that. They cannot wash their hands on the mental health emergency we have. Mental health is not a 9 to 5 issue, it is a 24/7 issue and has to be resourced to reflect this.